Assalamualaikum. Today we are just in the lecture hall of community medicine, and the topic is introduction to community medicine, and this is a fourth year MBBS, but the other students of different courses can also learn from the community medicine, because this subject is taught at the postgraduate level, undergraduate level, even in nursing and in many other fields also. So at the end of the session, a student should be fully oriented with community medicine course and objectives and contents. Understand the definitions and concept of community and preventive medicine and public health. Understand the concept of health research. This is important because the EMDC curriculum has emphasized on the research in fourth year and at the undergraduate level. So we shall select the topic of the public health importance, and 10 to 15 students will prepare synopsis or a scheme of the study. It will be reviewed, approved by the university ethical committee, and ultimately questionnaire will be filled and data will be analyzed, and the whole research will be developed in the form of article that will be sent to the medical journal for publication. For this, university will support, and today the dean was just asking from me. Last is know the core academic schedule of community medicine and research work in third year in public health. Next, please. So this is the community medicine study of health and disease in the population. And when we say population, means a specific geographical area and specifically people who are living there, their culture, their institution, their hospitals, their villages, towns, they all make the community as a living entity. Identify their health needs. This is important. Problems and needs. Needs are the perception of the community, while the demands are from the people. So, and to plan, implement and evaluate programs to effectively meet these needs. And needs are basically the important concept in, it is not disease, but it is the need of the health care, utilization of the health care. Next, please. And meaning of the research. This is important because the main focus of this lecture is research in community medicine or public health. The word research has originated from researchi, which means to travel through or survey through. This is the research after search and search. Careful search or inquiry into any subject matter and to investigate thoroughly. So it is basically an inquiry of the issue and then understanding, collecting the data. Next, please. Yes, research, the process of finding solutions of a problem after a thorough study and analysis. Analysis means you will segregate, you will differentiate, and you will see the pattern of the situation and ultimately draw the conclusion or inferences. Research as a movement from unknown to known, because certain layers are hiding the facts under it, and the research will uncover them and bring the real situation in front of you, in front of the people, and systematic effort to gain new knowledge. Next. Yes, research system, collection, analysis, interpretation, answers to certain question or solve a problem. This is basically the whole scope of the research. Research need to conduct in a systematic fashion, logical and orderly process. So systematic, logical and orderly process will make the conclusion, the results, the ultimate outcomes which you will implement in the future or in that setting to address such problem. Next, please. Research, when we do where we have a question or a problem or phenomena we want to resolve. We may already think we know the answer to our question. We may think the answer is obvious, but until we have subjected our problem to rigorous scientific scrutiny. So you have to apply scientific methods, means you have to design a questionnaire and collect the data, sampling, and even the time frame we call is Gantt chart. So all these ingredients are the part of the research are important. What is community medicine already deals with population and comprises those doctors who try to measure the needs of the population, both sick and well. So research and teaching in the field Faculty of Community Medicine of the Royal College of Physicians. This is definition. Next, please. This is another definition synonymous with preventive and public health. Prevention of disease and promotion of the health of community is basically the main work or main scope or main thrust or focus of the community medicine. Preventive, promotive, curative and rehabilitative services. Next, please. This is preventive medicine. It is specialized of medical practice, and sometimes family medicine is also called the specialized version of the community medicine. Yes. So public health is organized efforts of society, and people's health is in the center. It is the combined combination of science, skill, beliefs. This is important. The belief system about the health, about the disease, about the health services is important, which is part of the mission of public health is to fulfill society's interest in assuring condition in which people can be healthy. So health is one of the central questions, central theme of the public health. Next, please. This is public health is defined as the art and science of, this is Winslow definition, maintaining, protecting, improving the health of the people through organized community efforts. Public health is both a body of knowledge and also means to apply the knowledge. So it is application part. Next, please. Specialties. Environment, community, nutrition, school, mental health, health education, health promotion, non-communicable disease, communicable disease, demography, biostatistics, but the epidemiology is the heart of the community medicine, and biostatistics is also one of the important, we call it eyes and ears of the community medicine. Next.
Yeah.
And
Yeah. Next.
Okay. So these are the subjects or topics we are covering, and geriatric health means the health of the old age people, and health system and services also there, and international health apart from adolescent, reproductive, maternal health is important, and occupational health. Next, please. These are the references Park textbook epidemiology, WHO into CDC. CDC is important because it is the center of disease prevention and control, and nowadays the European CDC and even some other countries, they have their own African CDC. So I think in Pakistan, the National Institute of Health in Islamabad, as well as the different organizations under Pakistan Medical Dental Council and Pakistan Medical Research Council, College of Physician Surgeon and HAG, these are the institutions who are spearheading the research, education, medical education. So with this, we are ending our presentation. Hopefully you have learned the community medicine, role of research, role of population, and role of scientific method and scientific inquiry. So students of MPhil, PhD, MPH and MBBS in nursing can learn from this lecture, and ultimately most questions are asked from community medicine definitions as well as the scope of community medicine and role of population, role of healthcare delivery system in improving the health of the community. So basically it is a team which is called health team, led by the medical professionals, supported by nursing, paramedics and other community mobilizer, and the objective is that sickness should be less, health and healthy people should be more, so that they can go and participate in the economic, social as well as scientific and country development. Dr. Hussain Bashkolachi YouTube channel has given you this brief definition. Hopefully you will like it. Please, if you have any question, comments, like my YouTube channel, Dr. Hussain Bashkolachi. Thank you very much.